Hello everyone. My topic is factors associated with combination therapy of thiazide and loop diuretic versus loop monotherapy in patients with acute decompensated heart failure. First is my background. The standard treatment for acute decompensated heart failure (ADHF) is intravenous IV loop diuretics. Nevertheless, up to 20 to 50% of hospitalized patients with ADHF have a poor diuretic response to IV loop diuretics, which is associated with poor prognosis and require combination therapy with thiazide diuretic like hydrochlorothiazide. Concern about renal safety and electrolyte abnormalities raised doubts about the early combination of thiazide diuretics. While the recent randomized control trial confirmed the efficacy and the safety of early hydrochlorothiazide combination therapy, the real-world data are still lacking. In our objective, first, what is the proportion of early combination hydrochlorothiazide in ADHF patients? And second, which baseline characteristics tend to early combine hydrochlorothiazide in ADHF patients? In our method, we are a medical center cross-sectional study approved by the IRB, and the patient enrollment process is shown in the figure 1, and we'll talk it later. Discrete and continuous data were analyzed using chi-square or fracture exact test and Matt-Winning U test respectively. The association between early combination hydrochlorothiazide and the baseline characteristic was examined using univariate and multivariate logistic regression, and the adjusted variable were selected through stepwise regression. Figure 1 is a flow diagram summarizing the patient enrollment process. So first is our inclusion criteria. We include age above 20 and diagnosis congestive heart failure who are receiving IV loop diuretic with the first 7 days in the first emergency or hospitalization during 2016 January 1st to 2020 December 31. The patient are 6,416. And this is our exclusion criteria. And first is patient use IV loop diuretic after the second day of hospitalization. The second is patient combine hydrochlorothiazide with IV loop diuretics after first day of hospitalization. And third is patient receive dialysis in the baseline period. And the fourth, the patient with kidney transplantation, HIV or pregnancies in the baseline period. And after exclusion criteria, there are 329 patients in combined group, and there are 3,164 in IV loop group. And here's the result. Table 1 is baseline characteristic, and Table 2 is associated factors in early hydrochlorothiazide combination in ADHF patient. And the figure 2 is proportion of early combination hydrochlorothiazide in ADHF patients. And it's summarized of 3,493 patients. 329 patients received early hydrochlorothiazide combination, according to Table 1 in the Figure 2. And after adjustment, adjusted factors of early hydrochlorothiazide combined with outpatient oral loop diuretic mean daily dose. Odds ratio is 1.28, and outpatient thiazide use, the odds ratio is 1.81. And the NT-proBNP, the odds ratio is 1.02, and EGFR, the odds ratio be 0.98. Albumin, the odds ratio is 0.53. So in conclusion, in hospitalized ADHF patients, early hydrochlorothiazide combination is associated with higher outpatient oral loop diuretic dose, outpatient thiazide use, higher NT-proBNP, and worse renal function and lower albumin. And this is my topic. Thanks for your listening.